They knew. They knew that what they did was wrong.
Correct.
In the last hour here on Good Evening Arizona, we introduced you to a Valley woman who is part of a new eye-opening Netflix documentary. Unlike pharmaceuticals, medical devices don't have to go through any clinical trials to get FDA clearance. And once they hit the market, there's very little follow-up to see if these potentially life-saving devices could be harming or even killing people. Well, now we're hearing from an industry insider.
Yeah, this federal whistleblower happens to live here in the Valley and says medical device sales reps are flat out told, blame the surgeon, blame the patient, destroy documents.
Johnson & Johnson was charged with crimes that cost them $18 million. The medical device that I had blew the whistle on was removed from the market worldwide, and 2 executives have been convicted of federal crimes.
Melena Lukoski says she is the first federal whistleblower under seal to go public blogging under her own name, trying to expose industry secrets on the disturbing power of the medical device industry.
We have more power in this room than most governments around the world.
We can no longer rely on the medical device companies to do what's in the best interest of the patient.
It's the subject of a new Netflix documentary, The Bleeding Edge, profiling patients like Phoenix mother Kimberly Huddleston, who say the medical devices doctors put in their bodies made them sick.
I went in and I said, I need this removed. And they said, you need to leave.
Unethical and illegal behavior is encouraged, replicated, and rewarded. And those who expose the truth are eliminated.
Melena lost her job as a sales rep for Johnson & Johnson when she started asking why they were selling a medical device cleared by the FDA for one thing and intentionally using it off-label for something totally different. This is the Stratus, pitched to the FDA as a device to maintain sinus openings. It was sold to thousands of hospitals as a new way to deliver drugs like steroids.
They told us to destroy all documents. That is a huge red flag.
You're supposed to report to the government when there's a problem with your products.
They don't want you to report any of the problems, because what happens is then they don't have to take accountability. They'll blame the rep. You didn't train the surgeon right. They'll blame the surgeon. He didn't pick the right patient. They'll blame the patient. Well, the patient didn't go back to the doctor.
Ultimately, it's going to take industry insiders like you to flip, to really shine a light on how extensive this problem is.
Employees are the first line of defense to protect the public. It's one thing for an employee to come forward. It's another thing when you're an injured patient coming forward and fighting. It is so admirable and it is so inspirational, and that is really why I hope that people pay attention to that part of this and really help these women get their story out there, because that's how we create that change.
The FDA says they're working on new initiatives to better protect patients and support safe innovation every step along the way. From the initial FDA clearance to tracking patient complications, concerns, and deaths, through regulation to hold these powerful companies accountable with their medical device safety action plan. Melena's bosses have already filed appeals awaiting sentencing.
Meantime, they've been convicted, but they're still working in the industry.
They are. They're still executives at venture capital-funded startups.
Must make your blood boil.
These guys are the heroes of Silicon Valley right now because they're willing to take the Fed fall. These companies build $2 billion annually, that's with a B, into their budgets for federal fines. Well, they don't want to pay the victims, but what they're willing to do is cut a check to the feds and then just keep doing what they're doing.
The FDA acknowledges their tracking system is antiquated. It's not real time, so they are also working to make it easier for patients to report complaints and concerns directly, so we're not just relying on the industry to self-report. The Bleeding Edge is on Netflix right now. More on the backstory on the ongoing fight for Valley patients on our AZ Family News app now.